Folks, thanks for joining us today. My name's John Dubas with Premier Marketing, and we'll be spending the next 50 to 60 minutes speaking of a program that enables you to really focus on the remaining 5 effective dates that we have in 2022. There's a lot of talk about the certifications for 2023, which is, of course, a necessity, but we have things we need to accomplish yet in 2022. And our carrier partner presentation today is a big part of that in North Texas. And this refers to our partners over at Care. We have the distinct pleasure of having Steve Plocek come on and discuss some of the advantages of working with this company and the programs that they offer. And we welcome that presentation. Thank you, Steve. You'll notice in the software package that there is a section for both questions and chat. We ask that you put your questions in the question section. We find that generally we cover them all through the course of the presentation, but we will make certain that we answer anything that's in there and make certain that you receive full value out of the time that you're investing in watching today's presentation, which is being recorded and will be made available on our website at premiersmi.com and on our YouTube channel as well. I recognize many of the names on the attendees, and I thank you for coming on with us here today. But there are some folks that I'm not as familiar with. So let's start with a wee bit of level set about who Premier Marketing is. We are a national marketing organization founded in 1968. That's part of the Integrity Marketing Platform. Offices across the country. We're licensed in all 50 states. And we act as an insurance wholesaler working with independent insurance agents such as yourself through contracts that are at the highest possible commission levels with recruiting contracts available to those who qualify. And we do so through a full portfolio of products that's aimed at the Medicare market for a good portion of it, but also some folks that have the need of our help below the age of 65 and Medicare eligibility. The basic Medicare programs, the Medicare Advantage, Medicare Supplement, and standalone Part D programs are obviously a big part of what we do. And the programs we discussed today are Medicare Advantage programs. But we also have a full portfolio of life insurance and annuity programs, final expense life insurance and pre-need plans, long and short-term care programs and disability income plans, and those ancillary benefits to fill the needs of people with specific situations, such as programs to help with dental, vision, hearing, critical illness and cancer plans, hospital indemnity programs, accident plans, and telehealth programs, all set up on an individual basis to address the needs of our prospects and clients. Our Medicare Advantage program that are there, the national carriers are with us, as are many of the strong regional carriers that can make a difference for you in our markets, your market specifically. And in North Texas, that does include our partner presenters of today with Care. When we look at the prescription drug programs, in many cases, these come as part of the contract that you have for the Medicare Advantage plans, with a couple notable exceptions here. Mutual of Omaha doesn't offer MA plans, but they have a standalone Part D program. It's a separate adjunct contract to their other businesses. And of course, CleverRx is a discount program and not a standalone Part D program, but helps with the cost of medications. So we include it in this category. In the Medicare supplement arena, we have a broad portfolio of products that are continually being added to. And one that I didn't add in time for today's presentation is the AFLAC program that is coming out as well. So you have a strong portfolio of products, and we want to make certain that we cover the entire gambit of the Medicare beneficiary population. So we have different marketing programs to help you be successful in this space. Steve will address one of the MA programs that's kind of unique to Care that works much as a Medicare supplement plan as well. So some interesting things that Steve will help us with in the course of today's presentation. When we look at those ancillary products in each of those categories, we have the national leaders there for you to serve the needs of our prospects and clients, but also, of course, give us additional marketing opportunities and revenue streams for our agencies. When we speak of the Medicare market overall, of course, you have the aging of the baby boomers, the silver tsunami, one every 10 seconds, 10,000 plus a day. If you're looking at things based just on Medicare eligibility at the age of 65, it's nearly an exponential growth. But we're seeing a number of that population that have access to Medicare benefits at age of 65 that choose not to take full advantage of those benefits for one reason or another. They may continue to work past the age of 65 and have group insurance for whatever reason it happens to be. You know, some of us at the tail end of the baby boomers, we got to work till 67 to get our full benefit with Social Security. And that may be part of the rationale there too. So it kind of tempers some of the 98.2 million people projected to be on Medicare by the year 2060. But this portion is more than made up for by the folks that are under the age of 65, qualify for Medicare benefits because of medical disability, and they are a group that really can get help with them through Medicare Advantage programs because the benefits are the same regardless of the age. For those of you active in the Medicare supplement world, you realize that in most areas, under age 65 is a plan A, and that tends to be fairly expensive with somewhat sparse benefits. So this is a very valid opportunity for that section of the Medicare population because they have choices. You know, they can decline Part B, which some folks that are continuing to work past the age of 65 may well find to their advantage, but there are some folks that just decline it because they don't want to pay that Part B premium. That can be a challenge down the road, but thankfully, the vast majority of people have their mind set on how they can best deal with some of the medical costs. They may self-insure for what Medicare doesn't cover with the regular classic A and B programs and pick up a standalone Part D plan to help with the medication cost. Or they may go the route that speaks to the standardized, modernized Medicare supplement plans and add a Part D program to cover expenses in that fashion. Or if you watch TV to any degree nowadays on some of the channels, you hear of the all-in-one programs espoused by former professional athletes, actors, all these other individuals that throw out some information that tend to confuse people, but it's bundled in that Part C program in the Medicare Advantage world that we as independent agents need to fully discuss and make certain that it is an option for people to explore. And that is the category of our presentation today with Care and Care, because they are Medicare Advantage Part C programs. And we want to make certain that the detail that we provide to our prospects and clients is relatable and understandable. So that means we need to deal with some of the acronyms that's part of our industry. You'll see from this screenshot off the CMS website, gee, a few months ago, and there are 4,420 acronyms to find on this. No wonder people can be confused. And part of it is it reminds us to limit our use of acronyms, or at least explain what they mean repeatedly through the course of our presentation to make certain that our population understands the options that are being made available to them, and they can comprehend the choices that are available for them to make. We see a lot of preparation at this time of year with the certifications and things in preparation for the annual election period from October 15th to December 7th. But what we want to concentrate on today is, of course, the course of business that is available to us through the remainder of the year. At the time of this presentation, we're nearly mid-July. That means we have an August 1st, a 9/1, a 10/1, an 11/1, and a 12/1 effective date that many people may well qualify to change through one of these special election periods, a SEP. The majority of people on Medicare probably qualify for one or another. The challenge is it the right thing for us to do? Because we also have special election periods brought on by certain circumstances for one reason or another, weather related, some other things that come into play that allow our people to change throughout the course of the year, even if we are technically in a lock-in period. So we want to make certain that we're able to reach out to the population and help them do a plan comparison, which can be to their economic benefit a great deal. Because Kaiser Family Foundation tells us in their surveys, well, the vast majority of people on Medicare, regardless of their choice of the medical coverage, they're not comparing plans year over year. And we look at this, and about 70% of the population aren't doing it. And we know, being active in this area, that can cost them some serious dollars. So we want to make certain that we are able to deliver the information they need to properly look at their programs and look at some of the options they have available that may be to their best advantage. And that includes Medicare Advantage programs as an option. And we want to deliver that information in the way that the population can best assimilate and understand what's going on. So that might be an initial outreach virtually by sending them information after procuring a scope of appointment and making certain that that's there. You may have to consummate that relationship through an inpatient or an in-person, an in-person visit, or it may be done all virtually. Any way that happens, we want to make certain that we work with a carrier that has that technology that can help us in that area, or with a marketing organization that has other tools, such as we do, to help make this as simple of a process as we can and still remain compliant and active in the area. Plus, optimize the hours in the day that we have, because the population, well, as more and more people are aging into Medicare, they become more comfortable with some of the virtual presentations that are there, because, hey, it's what happened when they were working. But even the folks that are retired for a number of years, our current situation with the pandemic has them much more aware of and capable of handling information electronically, because they're doctors, they're specialists. Even hospitals and dentists are delivering information in such a fashion. Many times the doctor's appointments were all virtual for a period of time. And many things that we do in our life that helps define us as people, such as celebrating with our faith-based families, well, a lot of that's been virtual too. So it's a situation where many agents have gone totally virtual. Some will hybrid it, and some of us are perhaps still the old face-to-face type of presentation. Whatever is best for you is something that you need to continue, obviously, but we want to make certain that we're able to take advantage of the newer technologies that are out there and how it can help us help people and our agencies. So we look to programs that can help us earn strong commissions throughout the end of this production year in 2022. And we do so by working with Care and our old friend, he's not old, it's the relationship is long-standing, Mr. Steve Plocek. So at this time in North Texas, we want to make certain that folks in this service area understand that Care is that valuable option that we need to utilize to reach the population in this area by working with plans that are incredibly strong with benefits, deliver a strong network of providers, and make things as seamless and as pleasant for the population we deal with all year round. So at this point in time, I'm going to turn control over of this presentation to Mr. Plocek and ask that he go through and visit with us in some general terms and some specifics on the options that Care offers for us in this area. So Steve, at this time, I turn the presentation over to you, and I thank you once again for coming on our program and helping us with this information. As they say on Star Trek, you have the helm, sir.
All right, so you see my screen, John, we good to go?
Oh, I see your screen.
All right, cool. Well, as always, John, I can't thank you enough for the opportunity to, have this chance basically to speak to the agents that you have an opportunity to work with. I mean, first of all, I just want to thank you all basically, period, for what you do. This is a tough business. John and I have been in this business for many, many years. We actually have sold in these markets and understand a whole lot. I'm not going to say every single thing that these guys run across out there, but a whole lot of it. And it's a tough job. It certainly isn't easy. And the best thing that I think that an independent agent can get or receive is basically strong partnership from a carrier. And I'm constantly looking for those type of opportunities. And we're going to talk about some of those specific opportunities that Care has. And even some ways that we're out there open, interested in looking at how to partner with different agents out there. But education is king. You guys are looked at as subject matter specialists by the populations that we serve, whether they're, whatever different products are out there. We're obviously going to be focused on Medicare Advantage and specifically this North Texas market today. But let's go ahead and get started. Let's see here. There we go. So what is Care? Care is a locally owned plan. All right. Care is a plan that is based here in North Texas. Plan started back in 2008. So we're looking about 13, 14 years coming up here. All in all, based in Fort Worth, Dallas-Fort Worth area here. We'll talk a little bit about what this means here at the top of the slide. A little bit more here in a couple of slides, but we offer 4 PPOs and 2 HMO plans. All of those plans except for one specifically are true MAPD plans. We have one MA only plan. And today we're going to focus on, you'll see here in about 4 or 5 slides, we're going to focus on this Care Choice Premium Plan, a PPO plan. But you can see where our footprint is. Again, 13 counties wrapping around this Dallas-Fort Worth area, really based here local. Owned locally, we're local, customer service is local. We really look for that opportunity for individuals that really truly understand the dynamics, the idiosyncrasies of North Texas. This is becoming definitely one of the strongest, most important markets by many of our carriers out there, the opportunities you guys have to partner with national carriers out there. And Care understands that opportunity. But all in all, you kind of can see there where we're set up and the different plans that we have. So we talk a little bit more about Southwestern Health Resources. Understand Southwestern Health Resources is the parent company of Care Insurance Company. All right. What is Southwestern Health Resources? Well, it's UT Southwestern and it's Texas Health Resources. That's what makes Southwestern Health Resources. If you're not familiar with these organizations, very well known, very dynamic, a lot of specialty physicians. I would definitely say really close, if not the Cadillac of the market is UT Southwestern. As far as mass goes, as far as footprint goes, as far as growth, you really see what Texas Health Resources brings to the table. So having that opportunity to work that closely with these folks is a big selling point for us. It really is. We have a strong understanding of what's going on in our market, and that clinical side is so very important when we're talking about a Medicare Advantage plan. So what sets us apart? Now, I know that many of y'all, you're contracted with many of our national players out there. We can go down that list all day long, right? Well, we're a local plan. Well, why does it make sense to do business with a Care? Well, first of all, if you look at basically the logo, Care, you don't see a D in that. We don't have deductibles on our plans, period. Okay. And I will tell you, I'm being very confident that I will be able to say that. as we move forward into the next couple of months, if you understand where I'm coming from. But there's no D in care. There's no deductibles on our plans, whether it's drugs, whether it's you know, a value-added benefit, whether it's just our regular medical plans. Being able to stay from those deductibles, it's easier for you. It's easier comprehension and understanding by the prospects, the folks that you talk to, your current members, what have you. Very aggressive move in the market. Actually, the second lowest, there's one plan, not going to mention by name, but all in all, sits at 2,500. So a very, very aggressive maximum out of pocket. That's the amount of money that your client, okay, a member of a plan, would spend on their medical. Not talking about their drugs, not talking about a value-added benefit, maybe like a dental or hearing benefit, what have you. I'm talking about going to the doctor, going to the hospital, emergency rooms, complex radiology, those kind of situations, ambulances, those kind of situations. That goes towards that maximum out of pocket, that move, right? Specials copays as low as $10. I will say that is the lowest in this market right now. If we're going apples to apples, looking at a Medicare Advantage plan to a Medicare Advantage plan, I'm not comparing a C-SNP, I'm not comparing a D-SNP. It is a very aggressive, you know, co-payment out there. Our Part D offerings, John kind of you know, spoke a little bit of that in his opening, and we really do. I mean, the number one concern for Medicare eligibles today is Part D, is drugs, it's pharmacy. As you guys basically remember, unless you're super, super young out there, growing up, we didn't see, you know, pharmaceutical ads basically during the nightly news. Okay, that's just not what we did. That has become very, very important to basically really our population period, but most specifically individuals on a fixed income really concerned about their Part D, their drug coverage, right? So you can see that our Part D Tier 1 will have gap coverage on all of our MAPD plans. All right, so Tier 1, boom. Now, back in the day when John and I started, you know, first started selling these plans and ran into 2006 when the whole donut hole and election periods, you know, began, the first question was, well, you got any gap coverage? You don't have any gap coverage. You're seeing more and more plans do this. We're not totally unique in this scenario, but again, something that simplifies it for your members, for agents. It's a great situation that all Tier 1 drugs are covered through that gap. If we look at some of our select COPD inhalers, they also basically have gap coverage, all right? We get more specific on that, not in this presentation, but if you have questions about that, please don't hesitate to reach out, Mr. Dubas, put us in contact. We'll certainly be able to help you in that situation. Some of our insulins, the select basically insulins also, you know, you need to understand when those drugs get in the hole, when they get in the donut hole, you got to pay 25% now. It's your responsibility as a you know, a member of a Medicare Advantage plan. When you hit that donut hole, boom, that's a significant amount of money. You can really start talking about that when you talk about those COPDs. What happens in that scenario if an individual basically forfeits taking their medication? They're going to end up in an emergency room. All right, and that's a lot of times the best case scenario. Maybe admitted in the hospital, but again, those can be best case scenario. So you're really talking about some information or situation that you really have an opportunity to have big impact on. John talked about doing the right thing. I can tell you basically being in this industry as long as I have, and I know Mr. Dubas feels the same way, right person, right product at the right time. I'm going to say that one more time. The right person on the right product at the right time. And that's where basically when we're coming up to this AEP, you know, time of the year, that individuals are taking the time to really understand, hey, what their benefits are, how their benefits are changing, what are different opportunities out there. All right, I can tell you just going through the bid process, there's a lot of work and a lot of forethought and us understanding basically the dynamics of our market and how we can best basically suit the needs of as many of the individuals in North Texas as possible. We look at, you know, some of our medications, back to the slide there, you know, $35 basically for 1 month or $70 for 3 months. So buy two, get one at no charge in that scenario. And then, hey, look, it's not just me sitting here talking about some of these COPDs, some of these insulins out there. You go and put the drugs into a calculator out there like Medicare.gov, and you're going to see Care and Care bubble right up there to the top. All right, so this isn't just me giving you a big sales pitch or what have you. All in all, go look at what the stats are. Another thing that sets us apart is a $7,500 dental rider. $7,500 dental rider. We'll talk a little bit more about that, but I want to talk really specifically about one of our plans first. So check this out. Lean into the screen a little bit, might be a little small, but I want you to start looking at the co-payments for primary care, specialist, inpatient. Guys, this is not a dual SNP plan. This is not a special needs plan for folks that are on Medicare and Medicaid, a D-SNP plan. All right? But you're like, whoa, 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 whoa. Well, there's a $200 premium on it. Okay? $200 premium. So we're looking at an annual cost, you know, hey, that's not cheap. When I first saw this plan, I actually saw this business plan of a Medicare Advantage like this up in Wisconsin for the first time, probably back around 2012. Kind of freaked me out. We're really used to selling zero premium plans out there, all right? We a lot of times struggle with that because people just really have trouble comprehending how is there no premium on this plan? That's just really hard. It's too good to be true, all right? I've been in front of people, go through it 10 times, still come out, bring out a checkbook, say, hey, who do I write the check out? Right? Whoa, that's not the way this works, right? Now, I will point out something on this screen. If we look at that maximum, that out-of-pocket max, well, how in the heck can there be a $3,500 max on it if everything's zero? All right? We stay in network, there's a $3,500 move. We go out of network, it's $10,000. Well, we have co-payments over here if we're out of network at 30%. 30% of the Medicare allowable, right? But if we stay in network, we make no co-payments, not even at the hospital, right? When we do our bid, we have to basically be able to put in a MOOP in that scenario. And you're sitting there thinking, well, the MOOP is really $2,400, $200 a month, 12. That's basically what your maximum out of pocket is, right? Well, when we do that bid to make certain that we can offer some of these benefits on the other side of the page over here, that we can have basically embedded dental, that we can have that vision, that we have these hearing basically benefits out there, right? We have to basically put that MOOP where it's at. So it's all about the bid in that scenario and how we have to represent it. But if you're sitting there talking to an individual, hey, there's no way if they stay in network using basically a ton of different doctors across basically Texas Health Resources and UT Southwestern, hey, there's no way they're going to accrue anything out of pocket in that situation. All right. Now, we keep going here a little bit. Talk about drugs. Again, you see that big fat no deductible at the page, at the top of that page, right? No deductible. So in that scenario, you see still very aggressive drug costs across the line, even as low as zero basically for your preferred generics. And again, we talked about those specific medications around insulins, around COPD inhalers, right? Those medications covered through the gap, just like we talked about. So relatively strong plan, all right? When you look at it, if you look at what that cost is, there's a specific individual that this is for, all right? So if we talk about this, when is the right place, basically? When's the right time? Who's the right kind of individual to put in a plan like this? Well, obviously, it's going to be somebody that's most likely in that med sub market. Either they're already there or they're very strongly considering a med sub. All right. But if we talk about an individual who's currently on that med sub due to some medical issues, hey, they want to change a plan, basically, what have you. And hey, they're not going to make it through underwriting. We know that. All right. This would be basically a plan pending what? Pending that network. All right. Currently on a med sub, they're paying more than $200. Look, we all know though, many of these med subs out there are what? Age-rated products, right? So that cost is going up. All right. This is a situation, hey, they can control that. They can stop that basically cost at what? $2,400 basically of that same exact coverage that they have, as long as they stay in the network. I'm always going to throw that disclaimer in there. All right. If we have basically that $200 premium, understand that includes Part D coverage. I just showed you basically what those co-payments are regarding, you know, the PD or the Part D aspect of this Medicare Advantage plan. Plus, you're getting all those value-added benefits as far as that vision, buying into basically hearing, buying into basically even having dental coverage. And we'll talk a little bit more about that $7,500 here in a couple slides. But I want to do a little bit more. I want to break down. I did a little bit of math. All right, some real basic math here. And again, these are generalizations, these are averages. But if I go out there and look from an individual, you know, ranging from probably closer to about 67, about 72 years old. We look at a plan G out there, we're probably talking about 125 bucks. And you're like, whoa, wait a minute. Yeah, I know, I'm being conservative. Okay, I'm being conservative with 125 bucks a month premium on that plan. We go look at the average cost of a PDP out there, just talking about the premium. I can find single digits, I can get up into triple digits basically. I can find an over $100 premium plan out there. All right, so again, very conservative, very conservative. So if I take that 150 bucks there, 125, 25, multiply that times 12, I'm going to come up to what? $1,800. $1,800. But hold on. Average prescription drug deductible out there. We know a lot of plans out there hanging around 480. That's the max. There's certainly plans out there that are lower than that, right? So I went in there. I feel, again, fairly conservative with 380 bucks. Well, now we just throw, hey, now we're up to 2,180 bucks, right? Then we go through, remember that Part B deductible, that medical deductible that individual's going to have to pay, right? It's 2413, 2,413 bucks. So in that scenario, if you would be on a Care & Care PPO choice or premium, all right, excuse me, not choice, Care & Care premium PPO, you'd be saving $300 at a very conservative mathematics show there, not even talking about all the value added benefits that we get. So I think this is something you need to think about a little bit here. And you're going to see more and more of these types of plans, a high premium plan, low co-payment plan out there, all right? You're going to see more of them out there. And I'm constantly looking for unique ways to represent myself, all right, or what a plan is, or you need to be. So why would somebody buy from your next door neighbor who's a licensed appointed servant or agent compared to you? What are you doing different out there? Well, as a carrier, I think that same way. Where am I unique? How can I basically differentiate myself from my competition? Bottom line, right? So let's talk a little. Oh, there you go. Forgot my last button there. So we would be sitting at that $2,400, right? And we beat that in that scenario. So extra benefits, value-added benefits. As many of the Medicare Advantage plans have out there, they'll have maybe a dental company that they work with, or you know, they're working with maybe somebody such as iMed out there as far as vision coverage for glasses, True Hearing for hearing aids, Silver Sneakers, or a fitness program such as that has become very standardized within the Medicare Advantage space. Mom's Meals, again, another one. Cost-based covering Medicaid or covering meals up to 30 meals basically total, you know, after basically an inpatient stay. MD Live, we're seeing more of this with basically the pandemic over the course of the last couple of years. And even before that, you were starting to see a little bit of it. I think there's a lot more play on it now, but you're seeing MD Live as the provider that we use as far as telehealth goes. All right. So let's keep kind of going here. Let's talk a little bit more about that dental thing. That has to be sticking in your head. $7,500. That's right. Well, wait a minute. What's the catch on it? Okay, it is a rider. So that means there's a premium on that plan. On our HMO plans, we have 2 HMO plans. Those HMO plans, it's a $25 a month premium. On our PPO, we have 4 PPO plans, such as the plan that we just talked about, that Premier PPO. It would be $26 a month to get $7,500 of annual benefit. Once again, there's no deductibles, man. We don't have deductibles on our plan. Again, there's not a D in Care & Care, right? What are some of the things that are covered? Implants, crown, dentures, you know, those kind of things are covered on this plan. Over 4,800 contracted dentists. Still got to say, man, what's the catch? I'm with you. I always will be a sales guy at the end of the day, whatever my title is, whatever I'm doing. I'm always going to come at this from an angle of what it's like meeting with somebody basically across from a breakfast table. talking to basically that individual over the phone, what have you, right? Looking at these folks that, you know, the way that I look at my parents. But what's the catch? The catch is it's up to 50% of the cost of whatever the procedure might be. So let's say we had a $1,200 crown. Your member, your client is going to pay $600 for it. DentaQuest, Care, is going to pay the other $600 for it. So it's up to 50% of that procedure. Once again, that $7,500 annual maximum benefit is what? It's up to 50% of that procedure. So at the end of the day, you got $15,000 worth of dental, you ain't gonna pay $15,000. Not if you're on basically a Care HMO or PPO, you're gonna pay half of that cost. You're gonna pay $7,500. Understand, guys, when people start talking about implants, those things ain't cheap, all right? They're not at all, right? So that's really what that dental plan is. A little bit about the Care support team. We're here local. I understand how important it is to have a strong partner out there. A strong partner out there such as Care. Explain those benefits, different kind of training such as a scenario today. Helping find basically a doctor or a provider in a scenario, all right? Verify that coverage, basically assist members with claims and billing processes. A lot of times, what is somebody going to do the first time they have an issue, a question, a concern? They don't understand a piece of mail that they got from their health insurer. They're going to call who? They're going to call the agent. We're here to support you in that scenario, all right? We're here local. We understand the dynamics of, you know, hey, why don't you just go to this doctor over here? No, we understand what the traffic ballpark is. We're not going to ask you to go to a doctor 3 counties away just because they're listed in a book with a network. Marketing opportunities, community. Within the community, we have those kind of opportunities. We're constantly looking to plug basically agents in to represent not just Care, but you know, different plans out there. Yeah, at the end of the day, do I want to sell Care? I most certainly do. But at the end of the day, what's most important to me, once again, is doing the right thing for these individuals. Finding that person. Is this the right time? Is this the right plan for that individual? That's what's most important to me. And also contracting and commissions. That local support team is here to support with those types of questions, those types of concerns, most certainly. So a little screenshot of our team right now. We have 2 field sales managers. Miss Trish Cloud, brand new basically in this scenario, just been here a little bit, about a week or so. A lot of basically, you know, experience within our industry. Mr. Mike Arnold. And hey, if you don't know Mr. Tam Tai, it's a guy that basically is willing to do what it takes to get to help you out. Whatever it is, he wants to take care of you, he wants to take care of your clients. Super, really strong basically team here supporting me, not as much supporting me, but supporting you, right? One thing that John touched on and that I should have put in our presentation today is certifications. Certifications will be out for Care on the 15th. July 15th, Care's certifications for 2023 will be available. We know that AHIP is a mandate or a prerequisite for Care, so you want to make sure you have that AHIP completed. AHIP came out, what, ballpark through the 20th of June, if I'm not mistaken. So all in all, understand those certifications will be available here very shortly for you in the next 3 days.
Steve,
guys,
can I
once again,
interject here for just a moment?
Yeah. Please, big guy.
If someone completes the certifications for 2023 and they're new to Care, will that take care of their certifications for 2022 for the rest of the year?
Most certainly, yes, sir.
Awesome. I mean, because that's important because we've still got 8/1, 9/1, 10/1, 11/1, 12/1 effective dates coming up, and the whole purpose of life in general and in the Texas heat where we're triple digits forever is, man, we got to pay that electric bill. We got to pay our other bills, and selling Care for the remainder of this year and not looking past the possibilities we have now for 2023. Obviously, we got to do the certs, but it's just such a grand opportunity for us now that I wanted to bring that up.
Most certainly. Good deal. No, great point, John. Great point. And a little bit of other support for you guys. Care basically, it has been included basically this past year as of 2022 through Connecture and Sunfire. Those are the main basically quoting tools that we work with. So all in all, that information's there. Applications can be taken, through those platforms, and you also could go to cnchealthplan.com, cnchealthplan.com, cnchealthplan.com. And you can go in there, you can log in, you can set yourself up basically, through that portal, and you can basically submit applications through that program also. So all in all, we're here to support you. Any kind of questions, please do not hesitate. Reach out to Mr. Dubas, let us know. We'd really like an opportunity to try to partner with you, answer any kind of questions for you, most certainly. At this time, I want to thank you once again. As I did at the top of the presentation, I know what you do is not easy. It's tough. And if you have folks that you can depend on, if you have folks that understand your point of view, and you're open to basically working with, a local plan here, Care, I'd really like an opportunity to shake your hand, meet with you, sit down, break even some bread, have a cup of coffee, and talk to you specifically about different kind of opportunities that you may have that we can leverage, or opportunities that we have that you can leverage. But at this time, John, once again, I'd like to thank you for this opportunity. I most certainly thank you for you giving us basically this opportunity to get in front of you and basically some of the members of your team.
Awesome. Thank you, Steve. I want to, before we switch off of showing your lovely visage and the thank you slide that we have here, I want to really emphasize the fact that when you look at MA plans, one of the key components on selling them successfully is the strength of the network. Yep. And I think what you have here with Southwestern Health Resources and the entities that make up that body of available providers, you have the cream of the crop, plain and simple. When you look at some of the providers in North Texas, I can personally testify to the proficiency of UT Southwestern's hospitals, the staff that is there that is so incredibly caring for patients and the people that are utilizing the care. And us as agents, one of the things that we really need to be made aware of is the fact that when we enroll someone in the plan, one of the things that Steve used to say, because we sat across the aisle from each other, is I want you to treat your prospects like they were your family, like they were your mom and dad. And I think that is a key component in one of the things that differentiates one plan from another. And when you look at Care, you have not only a superb benefit package, which is, really important, but you also have a caring delivery of those services. And I don't think you can underestimate that at all when we look at, why this plan and that sort of thing. So one of the questions, Steve, that popped up from Mr. Johnson is there a star rating thus far? What is the star rating for the Care plans at the moment? And then, of course, 2023, that doesn't come out until October or later for that time period. But star ratings for Care are very high. But Steve, can you give us a little bit of detail on that?
PPO is at a 4, 3.5 on your HMO plans. 3.5 HMO.
Mm-hmm.
4 on your PPO.
Okay. And you've got a strong selection of plans too that make that a delivery system that's just in the best interest of your prospects and clients. Yeah. So, and one of the things I think we have to realize too is, as Steve mentioned, when we looked at the service area in North Texas, you have many people in some of those counties, they're coming into UT Southwestern's hospital because it's a destination of care. So very important for us to remember how, well, it may be in some other carrier's network, but the delivery through the plan from the provider makes a huge difference. And I think that makes something that we really need to look at and understand. So thank you, Steve. I'm going to pull control back for just a moment, finish up with a few slides as to why someone would want to do this with Premier Marketing as opposed to, a ton of other good organizations, marketing organizations that are out there and are part of, an important way of contracting with folks. So let me pick this up. We've got Steve's presentation in there as part of the piece that we have here. Some of the things that you'll get with Premier Marketing is, of course, an ease of contracting. We can get you information on Care and the contracting that is there for the organization. And when we speak to the programs that are out there, sometimes you need the ancillary benefits that, cancer plans or whatever else that's a key need perceived by our prospects and clients, and we want to be able to deliver on that. And much as where everything's going electronic, it seems like contracting is that way too. It makes it in the long run easier for us, but you can create an agent profile here and contract with carriers electronically. We, of course, with Care will send you direct contracting for that organization to make certain that we get them as part of your portfolio. We do offer discounted E&O for qualified agents. What makes you a qualified agent? Well, you got to contract with us. And this is a plan you own. So it's not like being added to a blanket policy for one carrier or another. You own it. It satisfies that requirement that the insurance companies have there, regardless of whom you're contracting through. Premier Marketing is a very large organization, but we don't have everything. No one does. If they say they do, well, you might look them in the eye and see, are they quivering a wee bit there? But we want to make certain that we can protect you as well. And we want to make certain that we help you keep your license in play through the discounted continuing education programs we have available through our association with WebCE. We also have a program where you can improve upon your own benefit package with a modified guarantee issue, a disability income plan on which you're paid a commission on your own business. So we want to make certain that we're protecting you across the board. I mentioned at the outset of the meeting that these calls or these webinars and presentations are being recorded. They are available on our website. There's a page for that for you there as well, and on our YouTube channel. So when we look at ways of how you walk into a community and become the subject matter expert for different types of marketing initiatives and programs, these are available for you 24/7, and as today's presentation will be as well. So it can really help you be successful in ways of reaching out into the community through providers, through faith-based organizations, and other centers of influence that can make a big difference for you and your business. One of the things that we do offer without charge to our agents, you can tell that, much as Steve alluded to earlier, we're old MA agents, old Medicare Advantage agents. I have a hard time imitating JJ Walker and say free, but this is a program made available to agents contract with us or one of our platform partners that is without cost, free to you. It has a single universal login to multiple quoting engines that includes the two that Steve alluded to earlier that are powered by Connecture and Sunfire. CSG is also in there. It gives you then the opportunity to make compliant side-by-side plan comparisons. So you can show people in Care service area of how well they stack up against the competition. And you can do so in a compliant fashion because you collect those scope of appointments and store them for that 10-year period within this as well, whether you sell them or not. A lot of times people forget, well, I didn't sell them, I don't need to file the scope. Yeah, you do. But it's a great way also to then make certain that you can follow up as contact information is available and do so on a regular basis. There is also a CRM for the agents that are in there that's complimentary, and other resources that, well, they include call scripts and other things that can make a difference for you in growing your business. As some of the programs that are out there, the MA and PDP programs, the max comp is set by the government. So there aren't carrier incentives per se in that area, but other avenues such as the ancillary products or med subs or whatever do offer carrier incentives. Sometimes it helps you qualify for those carrier trips, and it will help you also qualify for the premier incentive programs as well. We want to make certain that you get fully compensated for your business. And so we have a page on our website that is devoted to a listing of those incentives. We do also help get you in front of folks. We have a custom call list that's available to you. You cannot cold call for MA or PDP programs, but you can for med subs, you can for final expense, you can for dental programs. It's a great door opener to help you fill your funnel of T65 folks, because one of the things that happens with dental programs at age 65, there's a rate increase. So reaching out to people at a discounted rate, in a manner of speaking, for those programs can be a very effective marketing tool. We do have also programs that set out to help you maximize outreach into your community through the retail marketing programs that are out there. A lot of talk about Walmart year after year, but also ways of reaching into the faith-based organizations, whatever that faith is based on, ways of approaching and doing so successfully to reach a population that many times is not responding to other types of marketing efforts. And that includes provider marketing. We talk about the power of Care and Care's network. Let's look at some of the folks that deliver upon the care and how we can work with them to grow their business as well. Carriers do occasionally generate prospects that are available to agents, but that is kind of a quid pro quo type of situation where you're working with them, you're demonstrating your value, and so they will help you in that regard. We do have internet leads through social media as well, direct mail support, a really cool T65 locator, and a referral program that reminds you of how to subtly ask all the way through the process, from setting the appointments through the sales process, and then working your book of business as well to generate additional folks for you to visit. That direct mail program is deeply discounted, and based on production, you can qualify for 2 mail drops per month. One is through the health programs and one is through final expense, should you meet those production requirements. We do so through vetted preferred lead vendors. We want to make certain that they have the technology to get those leads to you as quickly as possible, and that the letters going out, we vet them to make certain that you are able to stay in compliance. We want to make certain that we protect you in that fashion. There's also a way to fill in some of the holes in your calendar through never distributed direct mail leads through one of our platform partners. Costs will vary from time to time throughout the year in areas as well, supply and demand type of thing. The prices listing here are as high as I've seen them. Generally, they're less expensive than this, but an MAPD lead at $32 a lead off of direct mail that's hot, that can make a big difference for you. The internet leads is through a Facebook campaign. There's a program for final expense and for Medicare there. The thing with internet leads is they're a microwave response, and they expect a microwave response from you as well. So we want to make certain that we're able to deliver upon that information as quickly as possible. At T65 Locator, this is another tool available to you without cost, yes, free. You can download it to your smartphone, register for it. They check and see if you have a contract with us, made available to you, and then you can actually locate people geographically. For folks that door knock, please, dear God, don't be doing that for Medicare Advantage or PDP programs, but you can for Med Sup, you can for final expense, you can for dental, you can do it with a plethora of different other programs out there. A great tool to help identify that population. That retail training piece, well, that was a couple of weeks ago where we had a webinar specifically on that, but there's a recording on there that reminds us to do the obvious. The challenge with referrals is statistics show that only 11% of the agents ask for them. So the whole politically incorrect Pepe Le Pew trying to kiss Penelope the cat, well, you don't get kissed if you don't ask. This gives you a way to do so, kind of tips on how to do so compliantly, and making certain that you can maximize the value of any lead, however you procure it. We do all this because we want to work with you. We want your business. We want to be referable for you and your agent friends. And it gives you an opportunity to plug this in now. If you're in North Texas and you don't have Care and Care as part of your portfolio, well, you really need to reconsider that and get them going as quickly as possible. So as John Wayne says in the movie The Cowboys, slap a piece of bacon on that biscuit, saddle up, let's ride, because we're burning daylight. You can do it now. And as Steve mentioned, completing your certifications in less than a week for 2023, it gives you the opportunity to sell for 2022 in Care as well, as your contract is up and going, and gives you an opportunity to actively market now. We've all got bills to pay through the end of the year. Don't procrastinate. Make it a part of your portfolio. So that said, we're finally at the piece where I need to thank you. I didn't do it on the onset like I usually do. A little sleep deprived day. I apologize for that. For those of you that have done business with us here at Premier Marketing, I thank you for that business. I sincerely do. I appreciate the opportunity to expand upon that portfolio with Care and other carriers that we can help you with. For those of you that are considering doing business with us, I thank you for that opportunity. We look forward to future discussions in order to make that so. But at this point in time, I have sucked 53 minutes, thereabouts, 52 minutes out of your life. I thank you for the investment of your time with us here today. And for those of you viewing this webinar recording in the future, I thank you for the time that you're putting into this to investigate the opportunity you have in North Texas with Care. I sincerely thank you for that. So all said and done, checking for questions really quickly. We're good. I want to thank you once again for your participation in today's webinar. And until we are able to visit again, I wish you good selling. Thanks so very much. We'll talk to you soon.